What's happening, gentlemen? Dr. James Whittaker here, and today we're addressing a critical mistake that I see nearly every man over 60 making. A mistake that's silently destroying their prostate health and setting them up for serious complications down the road. This isn't about what you might expect. It's not about diet, supplements, or exercise, though those matter. This dangerous mistake is something that 90% of men do every single day without realizing the devastating impact it's having on their prostate. I've been treating men's health for over 2 decades, and I've watched this single behavior contribute to more prostate problems than any other factor. The tragedy is that it's completely preventable once you understand what's happening and why. Today, I'm revealing this dangerous mistake, explaining exactly how it damages your prostate, and most importantly, giving you a simple but powerful solution that can protect your prostate health for years to come. Stay with me until the end, because what I share could literally save your life and preserve your quality of life well into your later years. What I'm about to tell you contradicts common medical advice, but it's based on solid scientific research and decades of clinical experience. This information could be the difference between maintaining a healthy prostate and facing serious complications that affect your comfort, sleep, sexual function, and overall well-being. The shocking statistics about prostate health. Before we dive into this critical mistake, let's look at some sobering facts about prostate health that highlight just how serious this issue has become. By age 60, over 50% of men have an enlarged prostate causing bothersome symptoms. By age 80, that number jumps to over 80%. We're talking about the vast majority of men experiencing prostate problems that significantly impact their quality of life. But here's what's truly alarming. These rates have increased dramatically over the past 30 years. Prostate cancer affects 1 in 8 men during their lifetime, with most cases occurring after age 65. Benign prostatic hyperplasia, or BPH, affects over 14 million men in the United States alone, causing urinary symptoms that disrupt sleep, limit activities, and create constant anxiety. But here's the critical point. Much of this prostate disease is preventable. The mistake I'm about to reveal to you is contributing to this epidemic, yet it's rarely discussed by healthcare providers because it challenges conventional thinking about men's health. The dangerous mistake: chronic dehydration and poor urination habits. The dangerous mistake that's destroying prostate health in men over 60 is chronic dehydration combined with poor urination habits. Specifically, the tendency to reduce fluid intake and delay urination in an attempt to manage urinary symptoms. Here's what typically happens. A man starts noticing he needs to urinate more frequently or urgently. Instead of addressing the root cause, he makes what seems like a logical decision. He reduces his fluid intake, especially in the evening, thinking this will solve the problem. Additionally, when he does feel the urge to urinate, he often delays going to the bathroom, either because he's busy, doesn't want to interrupt what he's doing, or hopes the urge will pass. This creates a vicious cycle that systematically damages prostate health over time. Before we explore how this damages your prostate, if this information is already challenging what you thought you knew about prostate health, please hit that subscribe button and ring the notification bell. I share evidence-based men's health content every week that could transform your understanding of optimal male health. This behavior pattern seems reasonable on the surface, but it creates a cascade of problems that make prostate issues worse, not better. Let me explain exactly how this mistake damages your prostate and overall urinary health. How chronic dehydration destroys prostate function. When you chronically reduce fluid intake, several harmful processes begin affecting your prostate and urinary system. First, your urine becomes concentrated, creating a more irritating environment for your bladder and urethra. Concentrated urine is more acidic and contains higher levels of waste products, minerals, and toxins. This concentrated, irritating urine sits in contact with your prostate through the urethra, creating chronic inflammation in the prostate tissue. Chronic inflammation is one of the primary drivers of prostate enlargement and dysfunction. When prostate tissue is constantly irritated by concentrated urine, it responds by becoming inflamed and eventually enlarged, leading to the very symptoms you were trying to avoid. Dehydration also reduces blood flow throughout your body, including to the prostate. Your prostate needs adequate blood flow to function properly, remove waste products, and maintain healthy tissue. Reduced blood flow contributes to prostate dysfunction and increases the risk of both benign and malignant prostate problems. When you're dehydrated, your kidneys work harder to concentrate urine and preserve fluid. This puts additional stress on your entire urinary system and can contribute to the formation of kidney stones, which can cause serious complications and pain. Concentrated urine also provides a better environment for bacterial growth, increasing the risk of urinary tract infections and prostatitis, inflammation of the prostate that can cause severe pain, urinary symptoms, and sexual dysfunction. The second part of this dangerous mistake, delaying urination when you feel the urge, creates additional serious problems for prostate health. When you consistently hold urine beyond the initial urge, several harmful processes occur. Your bladder muscle, called the detrusor, has to work much harder to empty completely when it's overfilled. Over time, this leads to bladder muscle thickening and decreased efficiency. A thickened, less efficient bladder doesn't empty completely, leaving residual urine that increases infection risk. Incomplete bladder emptying creates a backup effect that increases pressure throughout your urinary system, including pressure on your prostate. This increased pressure contributes to prostate inflammation and enlargement over time. When you regularly delay urination, your bladder loses sensitivity to normal filling sensations. This means you might not feel the urge to urinate until your bladder is significantly overfilled, perpetuating the cycle of incomplete emptying and increased pressure. The combination of holding urine and having an enlarged prostate creates a particularly dangerous situation. The enlarged prostate partially blocks urine flow, and the overfilled bladder has to work even harder to push urine past this obstruction, leading to further bladder and prostate damage. Let me know in the comments below. Have you noticed that reducing your water intake seemed to make your urinary symptoms worse rather than better? This counterintuitive connection is something most men don't realize until it's explained. Why this mistake is so common and dangerous. This mistake is incredibly common because it seems logical and is often inadvertently reinforced by well-meaning advice. When men start experiencing urinary frequency or urgency, their first instinct is to drink less fluid, especially before bed, to reduce nighttime awakenings. Many men also receive advice from friends, family, or even some healthcare providers to reduce fluid intake to manage urinary symptoms. This advice treats the symptom rather than addressing the underlying cause and often makes the problem worse. The gradual nature of this damage makes it particularly dangerous. You don't immediately notice that reducing fluid intake and delaying urination is harming your prostate. The damage accumulates slowly over months and years until symptoms become severe. By the time men realize their approach isn't working and seek medical help, significant damage may have already occurred. The prostate may be substantially enlarged, bladder function may be compromised, and more aggressive interventions may be necessary. This mistake is also dangerous because it creates a psychological component to prostate problems. Men become anxious about urinary symptoms, which leads to more fluid restriction and urination avoidance, creating additional stress that can worsen prostate function. The solution to protecting your prostate health is counterintuitive but scientifically sound. You need to maintain optimal hydration while developing healthy urination habits. This approach addresses the root causes rather than just managing symptoms. Optimal hydration for prostate health means consuming adequate fluids throughout the day to produce pale yellow urine. This typically requires about 8 to 10 glasses of water daily, depending on your size, activity level, and climate. The key is timing your fluid intake strategically. Consume most of your daily fluids during the morning and early afternoon, then reduce intake gradually in the evening. This maintains good hydration while minimizing nighttime awakenings. Quality of fluids matters significantly for prostate health. Water is best, followed by herbal teas and other non-caffeinated beverages. Limit caffeine, alcohol, and artificial sweeteners, as these can irritate the bladder and prostate. Room temperature or slightly warm beverages are preferable to very cold drinks, which can cause bladder spasms in some men. Adding a small amount of natural electrolytes, like sea salt or lemon, can improve hydration effectiveness. Developing healthy urination habits. Equally important is developing healthy urination habits that support prostate function rather than compromising it. The goal is to urinate when you first feel a reasonable urge, not when your bladder is uncomfortably full. Practice the first urge rule. When you first notice you need to urinate, go within a reasonable time frame rather than waiting until the urge becomes urgent or uncomfortable. This prevents overdistension of the bladder and reduces pressure on the prostate. Take adequate time to empty your bladder completely. Don't rush the process. Allow your bladder muscle to work efficiently by relaxing and giving it time to empty fully. Some men benefit from a technique called double voiding, urinating, waiting a moment, then trying to urinate again to ensure complete emptying. Posture during urination can affect emptying efficiency. Sitting down to urinate, especially if you have prostate enlargement, can help achieve more complete bladder emptying than standing. This isn't about masculinity. It's about prostate health. Avoid straining or pushing hard to urinate, as this increases pressure throughout your urinary system and can worsen prostate problems. If you're having difficulty starting or maintaining urine flow, this suggests prostate enlargement that needs medical evaluation. Research consistently shows that adequate hydration supports prostate health through multiple mechanisms. Proper hydration maintains optimal blood flow to the prostate, which is essential for nutrient delivery and waste removal. Well-hydrated tissues are more resistant to inflammation and infection. When your prostate receives adequate blood flow and isn't constantly irritated by concentrated urine, it's less likely to become inflamed and enlarge. Studies have shown that men who maintain good hydration habits have lower rates of prostate stones, which can contribute to prostate inflammation and urinary symptoms. Adequate fluid intake helps prevent mineral buildup in prostate ducts. Proper hydration also supports the immune system's ability to prevent and fight infections. Urinary tract infections and prostatitis are more common in dehydrated men because concentrated urine provides a better environment for bacterial growth. Research on prostate cancer risk has shown mixed results regarding hydration, but several studies suggest that adequate fluid intake, particularly water, may be protective against prostate cancer development. While correcting the hydration and urination mistake is crucial, several additional strategies can further protect your prostate health and complement proper hydration habits. Nutrition plays a vital role in prostate health. Foods rich in lycopene, like tomatoes, watermelon, and pink grapefruit, have been shown to support prostate health. Cruciferous vegetables like broccoli, cauliflower, and Brussels sprouts contain compounds that may help prevent prostate problems. Omega-3 fatty acids from fish, flax seeds, and walnuts have anti-inflammatory properties that benefit prostate health. Limiting red meat and processed foods reduces inflammation and supports overall prostate function. Regular physical activity is crucial for prostate health. Exercise improves blood flow, reduces inflammation, and helps maintain healthy hormone levels. Even moderate activity like daily walking can significantly benefit prostate function. Stress management is important because chronic stress can worsen prostate symptoms and contribute to inflammation. Techniques like meditation, deep breathing, or yoga can help manage stress and support prostate health. Several natural supplements can complement proper hydration and support optimal prostate health when used appropriately. Saw palmetto is one of the most researched supplements for prostate health. Clinical studies suggest it may help reduce prostate enlargement and improve urinary symptoms. Typical dosing is 160 milligrams twice daily of standardized extract. Beta-sitosterol, a plant sterol found in various foods, has shown promise for improving urinary flow and reducing prostate symptoms. It's often combined with other prostate-supporting compounds. Pygeum africanum, an extract from African plum tree bark, has been used traditionally for prostate health and has clinical research supporting its use for BPH symptoms. Zinc is crucial for prostate health, as the prostate contains higher concentrations of zinc than any other organ. Many men over 60 have suboptimal zinc levels, so supplementation may be beneficial. Lycopene supplements can provide concentrated amounts of this prostate protective antioxidant, especially for men who don't consume many tomato products. While proper hydration and urination habits can prevent many prostate problems, it's important to know when medical evaluation is necessary. Certain symptoms require professional assessment regardless of your hydration status. Difficulty starting urination, weak urine stream, or feeling that your bladder doesn't empty completely are signs of possible prostate enlargement that need medical evaluation. Blood in urine or semen, painful urination, or pelvic pain require immediate medical attention, as these could indicate infection, inflammation, or more serious conditions. Sudden inability to urinate is a medical emergency that requires immediate treatment. This complete urinary retention can cause serious complications if not addressed quickly. Significant changes in urinary frequency, especially if associated with weight loss, fatigue, or other symptoms, should be evaluated to rule out prostate cancer or other serious conditions. Here's your comprehensive approach to protecting your prostate health. Maintain optimal hydration by drinking 8 to 10 glasses of water daily, with most consumption in the morning and early afternoon. Develop healthy urination habits by responding to the first reasonable urge rather than delaying until urgency or discomfort occurs. Take adequate time for complete bladder emptying and avoid straining. Support your approach with anti-inflammatory nutrition, regular physical activity, and stress management techniques. Consider targeted supplements like saw palmetto, beta-sitosterol, and zinc if appropriate for your situation. Monitor your symptoms and seek medical evaluation for any concerning changes or persistent problems. Early intervention is always more effective than waiting until problems become severe. When you correct this dangerous mistake and adopt proper hydration and urination habits, the benefits extend far beyond just prostate health. You'll likely experience better overall health, improved energy levels, and enhanced quality of life. Proper hydration supports kidney function, cardiovascular health, cognitive function, and even skin health. The benefits compound over time as your body functions more optimally with adequate fluid levels. Healthy urination habits reduce anxiety about prostate symptoms and improve sleep quality by preventing the cycle of fluid restriction and nighttime urgency. Better sleep supports overall health and immune function. Men who adopt these practices often report feeling more confident about their health and more proactive about preventive care. This positive mindset contributes to better health outcomes across all areas. The dangerous mistake of chronic dehydration and poor urination habits is destroying prostate health in millions of men over 60, but it's completely preventable once you understand what's happening and take action. Remember, your prostate health is largely under your control through the daily choices you make about hydration, urination habits, nutrition, and lifestyle. Don't wait until problems develop to start taking care of this vital aspect of your health. The approach I've outlined today is simple but powerful. It addresses the root causes rather than just managing symptoms, and it's based on solid scientific understanding of how your prostate functions optimally. Start implementing these changes today. Your prostate will thank you, and you'll likely notice improvements in urinary comfort, sleep quality, and overall well-being within just a few weeks of consistent application. If this information has opened your eyes to a mistake you might be making and given you practical solutions for protecting your prostate health, please give this video a thumbs up, subscribe for more evidence-based men's health content, and share it with other men who need this information. Your prostate health is too important to leave to chance, and the simple changes we've discussed today could make the difference between a comfortable, healthy future and years of prostate problems and complications. Until next time, this is Dr. James Whittaker reminding you that optimal prostate health is achievable through understanding, prevention, and consistent healthy habits.